Hi guys, drawing hairline is a different art, and I call it the signature of the surgeon who is doing hair transplant surgery, because drawing hairline is the basic part of hair transplant surgery, which has been discussed many times. But what I am showing you is a very decent and natural looking hairline, which should be in the limits and suitable and fitting on the face of the patient. And you see at the end of when I will finish the drawing of hairline, you will see that it is actually fitting in the face of the patient. Then after, and what you need to keep in mind is, first you need to identify the anterior most part of the hairline, and then going posterior is the art of drawing a natural hairline. Then you can put mounds on each side of the hairline. While drawing a line for the strip harvesting on back of the head, you need to keep in mind that you should be harvesting a strip from central most area on back of the head, which is considered to be permanent at any age, like at the age of 80 or maybe more than that. And I have drawn another area which is suitable for FUE harvesting as well. So you need to see that with drying a little a strip and harvesting a little strip, you can get a large amount of hair from back of the head, and most permanent hair, moreover, from the central most part on back of the head, which is considered to be most permanent area, and putting on the frontal area. So this is what I was telling you.